Hi folks, this is Christian Brindle, Medicare health plan expert and specialist, and today I'm going to be talking with you about the difference between Medicare supplements and Medicare Advantage plan. Truth be told, Medicare is insanely complicated and it's very confusing for the average person, but if you can just understand Medicare supplements and Medicare Advantage plans, I think you'll understand 99% more about Medicare than the rest of the population. And when you get onto Medicare, there's really only two ways you can go with your Medicare specifically, unless you have some kind of a retirement plan. And that's, you can either go with a Medicare supplement route or you can go a Medicare Advantage route, and that's really as complex as it gets. Everything you ever hear about Medicare is all going to be in one of those two categories. So I thought this would be a helpful video that we could make here today. This is my company, Christian Brindle Insurance Services. We're located about 20 minutes outside of Salt Lake City, Utah. We work with people in 12 states, but we'll get into that a little bit more towards the end of the video, so stick around. So this is me. This is a little bit of an outdated, I guess, bio of me, but I'll kind of try to get through it. So I'm the founder and president of Christian Brindle Insurance Services. We're located in Sandy, Utah, which is a suburb of Salt Lake City. We've worked with hundreds of people on their Medicare and in the past 6 years or so, and our organization has worked with thousands of people over the years. Christian, which is me, I've written 3 books specifically about Medicare and insurance. The most popular one we've ever written is called Medicare Guidance, Picking the Plan for You. I host a very popular podcast about Medicare called the Everything Medicare Podcast, which is the #1 Medicare podcast on the internet today as a whole. This says we have 150 episodes. At the time of recording this, I think we have about 230 and pushing forward. So, and that podcast touches a lot of people. You can find it anywhere the podcasts are listened to on the internet today. It's just a little bit about me. Now, let's just get into the basics of Medicare. So at the time of recording this, I'm going off of 2020 numbers, so keep that in mind. There's a very real possibility that in 2021, the Medicare Part B premium will rise. And we'll try to make an updated video once we kind of get that new numbers about what that Part B premium will be, to kind of put it into perspective on how much it might be. The Medicare Part B premium in 2019 was about $135.50 a month, so it took about a $9 increase. But in 2018, the year before that, I believe it was in the $134 range. So it doesn't typically go up $9 or $10 from year to year, but we'll have to see what next year holds. But this is basically your Medicare basics. This is how Medicare can be looked at. So you have Medicare Part A, which doesn't cost you anything, as long as you've worked in the country for at least 10 years of your life. I know that might be a little bit overkill, but some people haven't worked that long, so those people don't get it for no premium. Medicare Part B has a premium that everybody on Medicare pays. For most people, it comes out of your Social Security check. If you have Medicaid that might be paying it for you, that's an exception. But Medicare Part A and B, and a nice way I always like to think of it is they kind of work like two pieces of a puzzle that fit together to give you medical coverage. They both cover different things, but at the end of the day, they both cover different pieces of medical coverage. Part A is most notably covers inpatient hospital care, which is overnight stays. It also covers skilled nursing facilities, hospice care, lab tests, surgeries, home health care, things like that. Medicare Part B will cover the doctors in the hospital, medical services, outpatient medical procedures like surgeries, durable medical equipment, amongst other things. And they're going to give you medical coverage. Now, how much medical coverage do they give you by themselves? Well, Medicare Parts A and B both have deductibles and different kinds of out-of-pocket that you're kind of faced with. But at the end of the day, after those numbers are met, those deductibles, typically they're going to pay 80% and they're going to leave 20% behind for you to pay. It's very important to notate that there's no max out-of-pocket for members on Medicare. So that means if you have a $100,000 hospital bill, it is very realistic that you will be looking at $20,000 potentially out of pocket, because whatever your bill is, there's no limit to it. You're going to pay 20% when you're on Medicare. Medicare also doesn't cover prescription drug coverage on its own, dental, vision, hearing. So there's a lot of holes other than the medical coverage that's left behind. Medicare by itself is limited, to say the least. So how does a person qualify for Medicare? Well, first you have to be 65 years old and an American citizen or a legal resident for at least 5 years to To get Medicare Part A at no premium, like we discussed at the beginning of the video, you have to have worked in the country for at least 10 years of your life or 40 quarters. There's exceptions to this, though. One example of an exception is if you're under the age of 65 and you've been on disability and you've received Social Security disability, SSDI, for 24 months consecutively, you'll typically be automatically placed on what's known as Medicare disability. So that's the way you can get Medicare under the age of 65. Are Part A and B enough? Together, Medicare Parts A and B provide someone with insurance that can assist with preventing medical bills from getting out of hand. And I think that's very true. However, the coverage by itself has large setbacks like we touched on, like deductibles, 20% out of pocket. This is why Medicare health plans exist. So the first way you can go with your Medicare is Medicare Advantage. And you see a lot of commercials about these. These are going to be your traditional Joe Namath commercials and things like that. These plans take the place of traditional Medicare and essentially run a member's Medicare through a private insurance company. Medicare Parts A and B still need to be active for this to work, which includes paying that Medicare Part B premium. Medicare funds the insurance company because a nice way to think of it is this Medicare Advantage company is taking the place of your Medicare. They're running your Medicare through that insurance company. They're basically passing off the responsibility to that insurance company. And Medicare doesn't have to pay anything towards your bills anymore, but you still have to keep your A and B active. They combine everything into one plan, including medical benefits, prescription drug benefits, and sometimes additional benefits such as dental, vision, hearing, that kind of stuff. Medicare Advantage plans are going to be more like your traditional health insurance plan that you might have had throughout your life, whether it be through an employer or maybe it was just an individual health plan. It's going to be more similar to that because you have everything in one plan. You don't have all these different working parts, if you will. So what are some pros and cons to Medicare Advantage plans? Well, I think the good are they're easy. I think everything's combined into one plan, so you don't really have to worry about all these different working parts. You have fewer premiums. Some plans typically will come with $0 premiums in a lot of areas because they get all this government funding. At the time of making this video in 2020, there's only one health question required, and that's if you have end-stage renal disease, which is essentially if you're on dialysis. Now in 2021, that question is going away, and they'll have no health questions, so even better. The cons of Medicare Advantage plans, the way I see it, is they do require networks typically, lists of providers, of hospitals and doctors, and you kind of have to stay in that plan's network. Some plans have great big networks and a lot of choices, and some have very small and tiny networks with very few choices. They come with copays on the medical side. So they don't come with 100% medical coverage. It's going to typically be better medical coverage than what Medicare will give you on its own. So instead of paying 20% of a medical bill, you're going to pay a set copay. And this can kind of vary depending on where you live, but those copays can be, for example, maybe $5 to $10 for a primary care physician visit, $30 to $40 for a specialist visit, maybe $200 to $300 per night in the hospital for the first 5 or 6 nights, and they'll pay everything after that. Maybe $80 to $90 for an emergency room visit, those kind of things. But and they're pretty reasonable if you think about it. They don't have deductibles like a lot of health insurance plans do. Typically, some plans do, but they're pretty reasonable. But if you are sick and you use it a lot, the copays can add up quite quickly. They can sometimes have pre-authorization restrictions that kind of make you jump through hoops and go through some red tape in order to get coverage. Like some Medicare Advantage plans will have referrals to see a specialist from your primary care physician, and that can be a little bit of a pain. So more red tape. Let's talk about Medicare supplements now. Medicare supplements come and supplement Medicare Parts A and B. They're going to come through and pay the 20% that Medicare leaves behind. So Medicare pays 80%. A Medicare supplement plan is a plan through a private insurance company, and they're going to come through and pay the 20% that Medicare leaves behind. Pretty simple, right? In the Medicare market, supplement plans are universally recognized as being the best medical coverage money can buy. Typically, there's some exceptions to this, like if you have TRICARE for life or maybe a federal plan, that can be an exception, but the medical coverage is really, really great. I consider it top shelf. Medicare supplement plans are designed by Medicare, by the government. The plans are standardized, which means the coverage is identical no matter what. What this means is there are different Medicare supplement plans that are designed by the government. The government designs them. Then they give them to private insurance companies to market. So, for example, if you buy a plan through Mutual of Omaha and there's another insurance company that has that exact same plan, it's going to be the exact same benefits as the plan you're getting from Mutual of Omaha if it's the same plan, but both insurance companies might charge 2 different prices. So that's kind of interesting. They're given to the private insurance companies to market. The insurance companies are going to determine how much they're going to charge. They're also going to determine how much the prices go up every year as the person gets older, and that can vary widely depending on the insurance company and that particular plan. So that's an important thing to factor in. At the time of recording this, here are the different Medicare supplement plans you have available. So not to confuse Medicare Supplement Plan A or Plan B with Medicare Part A or B. They just have nothing to do with each other. These are different supplements. They all pay a different percentage of what Medicare leaves behind. Plans F and C actually had a very big change January 1st of 2020. Anybody that became eligible for Medicare after January 1st of 2020 going forward, they don't have the option of purchasing those plans anymore. They're the industry's kind of moving away from those. If you were eligible for Medicare before January 1st of 2020, you're able to pick up those plans still. And we got this chart from our friends at Boomer Benefits. We just kind of borrowed it. Hope they don't mind. But and so these are the different kind of Medicare supplement plans, that exist out there. Kind of gives you an idea. Now, Medicare supplement plans don't pay anything that Medicare doesn't pay for. So since Medicare only covers medical bills, the Medicare supplements do the exact same thing. So if you want prescription coverage, that's where you enter Medicare Part D. Medicare Part D plans are individual prescription drug plans. D for drugs is an easy way to think of it. And essentially, they're going to cover prescription drugs, and they're purchased through private insurance companies, and they're pretty simple other than that. There's different types of prescriptions in the Medicare world. This is kind of important to know. There's Medicare Part D as in dog drugs, and then there's Medicare Part B as in boy drugs. Medicare Part D as in dog drugs are going to be your typical prescriptions that you go to the pharmacy and you fill, you go home, you take the drug maybe once a day or take a pill every once a day, something you take on your own. Medicare Part B as in boy drugs are going to be your high expensive injectable medications such as infusions or something along those lines. Those are going to be covered under Medicare as a medical charge. Whereas Medicare Part D drugs are covered by the prescription plans, and whether you get your prescription coverage with a Medicare Advantage plan or whether you get it individually from a Part D prescription drug plan if you go with a supplement, that can kind of affect your coverage quite a bit. So anyway, folks, I hope you found this video helpful, kind of understanding the different kind of Medicare supplements and different kind of Medicare Advantage plans exist out there. It's kind of a rough, generic overview, but I think if you got this far to the end of the video, I think you'll understand your choice is 90% better than maybe hopefully you did beforehand. If you'd like to work with my company on your Medicare supplement or your Medicare Advantage plan, whichever one you prefer, we do both. We work with people in 12 states. We work with a myriad of different insurance companies, so we're a brokerage. We can help you find the best available fit based on your needs and preferences. I'm going to put our number real big on the screen here. And we work with people in the states of Utah, Idaho, Colorado, Oregon, Washington, California, Texas, Virginia, West Virginia, South Carolina, Alabama, and Florida. So thank you so much for watching, folks. If you enjoyed this video, do me a favor, drop a like on the video. It helps us reach more people just like you who need to hear our message. And until next time, subscribe for future Medicare information, and we'll see you next time. Thanks so much.